So we're just going to talk about gluteal tendinopathy, which is a common problem with a lot of the patients that we see here at North Norfolk Physio. So often with gluteal tendinopathy, the patient will complain of pain on the outer part of their hip, so coming down into the greater trochanter on the outside of the leg. Often this pain is made worse when laying on your side, so often at night sleeping on your side can be really painful, and it can be painful both when laying on the side of the gluteal tendinopathy and also on the other side. And as you can see where Toby's lying here, there's a massive strain being put through the gluteal tendon area. When you lay on your side, you get this pull through all of these tendons that come in and attach on the bone here on the lateral side on the hip there. So the other things that patients present with gluteal tendinopathy is often pain is when walking, not necessarily stiffness in the joint, but more pain around that lateral side, and also when going up and down stairs and standing on one leg. That also can be really painful. So how do we treat gluteal tendinopathy? So what we tend to find is one of the reasons that we're getting the pain is that the tendons are being put on this stretch and are often quite weak. So one of the things that can really help with sleeping at night is by putting pillows between the knees. So you can see at this point there's quite a strain through these tendons. If we actually then put a pillow between the knees, and then sometimes a pillow also between the shins, we can then see that position is then, the hip and the back is put in much more of a neutral position. So this often can take the strain off of those tendons and can be a much more comfortable position for when you're sleeping. As I said also, that we find that there's quite a lot of weakness around those tendons. So what we tend to do is start a strengthening loading program for these tendons. So one of the exercises that we give our patients with gluteal tendinopathy is a loading exercise for the abductors. Often when loading to start with, it can be quite painful. So this is a really nice position to start the exercise in. So we've got a yellow band, which is a light band. So it's only a really light resistance. And Toby's got his pain in the right leg, so we're going to start loading that right side. It's quite nice to put something on the left side just to get the patient to think about stabilising the other side of the body, and also that helps them to get their core to start to kick in and engage as well. So all we're going to do here is just to get Toby to let his right knee fall out to the side, but by keeping his tummy button looking straight up towards the ceiling and keeping this little cup on the other leg. And then he brings the leg back, so it is a controlled movement coming back as well as going out. And we do that again. So it's not a massive movement, and he's controlling this side really nicely. And there's not lots of movement around the pelvis, it's just the hip that's doing the movement. And so initially we'd get our patient to do this probably 3 sets of 10, 3 sets of 12 would be perfect, probably every day. But if it's really quite acute, we might give our tendons a little bit of a rest in between. So we might be doing this exercise every other day. Okay, so another exercise we might give our patients that have a gluteal tendon issue is a sit to stand. So again, we're trying to strengthen those abductors. And a really nice way to do that is in a low sit to stand position. So if you can get into a low sitting position, again, we're using a yellow band, so it's a light band for resistance. And what we're really trying to inform our patient here is to really think about those knees going over their middle toes. So often the tendency here is when you go into a sit to stand is for your knees to come together, especially if you're weak in these abductors, which often you will be if you have a gluteal tendon issue. So we're going to encourage Toby to go into standing without using his hands, and really encouraging him to get the middle of his kneecap right over the middle of those toes. So off you go, Toby. Nice. And then we're going to get him to sit down and do exactly the same. So when we're doing this exercise, we're pushing against the band slightly just to keep that really nice abducted position through the hips. Do one more of those, Toby. And you can really see that the knees are going straight over those middle toes, and at no time are those kneecaps looking at each other.
So one of the other treatment modalities that we can use for GTPS or lateral hip pain is Shockwave. So Shockwave is quite a good one actually in terms of the results that we see from patients here. What is the Shockwave? So the Shockwave, it sounds a bit scary, but it's actually a sound wave that's emitted. It's not a shockwave. What the Soundwaves does, in a nutshell, it stimulates more of a sort of pain response, so it creates a numbing type effect, especially on quite a sore gluteal tendon, which can be really nice in terms of short-term pain relief and long-term pain relief moving forward. The second thing that it does, it also improves and reabsorbs that inflammatory type process again, coming into the side of the hip and into that tendon. So typically these tendons can be stuck into that mid stage of the phase of the healing cycle, where they're not getting better, but they're keeping and staying quite sore. So the inflammatory phase basically is that rebuilding phase in the body. So what we're trying to do with the Shockwave is initiate that phase again to get it a little bit more acute, to be able to that healing response to properly take effect. So typically we would use the Shockwave for people who have had this issue for quite a long period of time. Typically if you've just experienced lateral hip pain and is feeling quite sore, so we would call this in a more an acute nature, we wouldn't typically use this straight off the bat, and that's because that this tendon is going to be quite sore and irritable within those beginning or starting off stages. So we typically use this where people have had this for quite a long period of time, so typically after around sort of a 4-month period. And as we talked about last time, it can be really good at just starting off that inflammatory process again, which probably hasn't quite worked in the past, and also for that numbing effect.
So when you come into North Norfolk Physiotherapy with lateral hip pain, we would obviously do a complete full assessment on you, which would include up to an hour of us taking a full history from you and then doing our objective assessment, which would include us doing lots of different tests just to make sure what's going on with your hip, because there could be lots of other things going on with lateral hip pain, including your lower back. It could be more of an osteoarthritic problem with your hip. So we'd need to really make sure what's going on with your hip. If we do find that you've got a gluteal tendinopathy problem or a diagnosis, then what we can do is then go through a complete treatment protocol with you. So we'd go through a whole treatment plan. And that could include, as Toby has already mentioned, some Shockwave, but as he said, that's more for a chronic gluteal tendinopathy. So that would probably be a bit more down the road. But initially we would possibly obviously assess your back, and sometimes what we do find with lateral leg pain is that there is a back component and they come together sometimes as a bit of a confused picture. So often people with gluteal tendinopathy will also have a lower back issue. So it might be that some of our treatment would be for your lower back, immobilisation or perhaps soft tissue. And together with that, we can also offer acupuncture, which helps with pain relief. We would then also, as we've shown you, some of these loading exercises, we really encourage you to start loading the tendons if we do feel like it's a real gluteal tendinopathy with the exercises that we've shown. And we'd probably see you quite regularly to start with, to really encourage you to continue with those exercises and monitor your pain. We'd give you advice about your sleep and positions to relieve your pain. And then hopefully you'd start to see some improvement. And if you do feel like you need to make an appointment with us, then you can obviously call us, book online, or there will be a link to the booking description below.